Today, we're going to talk about a piece of cancer care that is absolutely critical, but for some reason often gets overlooked: rehabilitation. You see, for millions of people, the fight against cancer doesn't just stop with the last treatment. Nope, that's when a whole new challenge begins: the journey to actually get back to living.
And look, thanks to incredible leaps in modern medicine, more people are surviving cancer than ever before. In high-income countries, survival rates are just climbing and climbing. Take Korea, for example, where that number has hit a really impressive 70.6%. And that is a huge, huge win for oncology. But this success story has a hidden chapter. And that leads to a really important question. Is just surviving enough? The reality is, living longer, with or after cancer, often means you're facing a whole new set of hurdles. We're talking about the physical, the cognitive, and the emotional toll that the disease and its treatments can take. It really forces us to change our thinking, from just adding years to life to adding life back into those years.
So, what is this missing piece? What's the thing that bridges that gap between surviving and actually thriving? Well, it's a specialized field of medicine called cancer rehabilitation. So let's dive in and break down what that really means.
Okay, so the National Cancer Institute puts it like this. It's a process to restore mental and/or physical abilities lost to injury or disease in order to function in a normal or near normal way. And that's the key, right? It's all about getting people back to a place where they can function. It is so much more than just a few physical therapy exercises. It's a whole approach to regaining control, independence, and your sense of self.
And this whole philosophy really stands on four powerful pillars. First, it's patient-centered, which means your goals are what drive everything. Second, it's goal-oriented. We're talking about setting real, measurable targets so you can actually track your progress. Third, it's team-based, because hey, no single expert has all the answers. And finally, and this is so important, it requires your active participation. You are a partner in your own recovery, not just someone along for the ride. Now, there's a common misconception that rehab is something you do after you're all better. But that's not it at all. Real cancer rehabilitation is a partner that is with you through the entire journey. And what's really fascinating is that rehabilitation isn't just one thing. It's this dynamic process that changes and adapts to every single stage of the cancer journey. You can see on this timeline here, the goals of rehab look completely different depending on where a person is, from diagnosis to treatment and all the way through their prognosis. Let's walk through these four phases. First up, it can start even before treatment begins. This is a phase we often call prehabilitation. Think of it like training for a marathon, right? The idea is to build up a patient's strength, their physical and mental reserves, so they can better handle the tough stuff ahead, like surgery or chemo. This proactive step can actually lead to fewer complications and a much faster recovery on the other side. Then, during or after curative treatment, the focus shifts to the restorative phase. Here, the goal is pretty straightforward, but it's a big one. Help the patient get back as much of their function as possible. It's about empowering them to return to the normal rhythms of their life: work, family, all of it. Now, for patients who are living with ongoing cancer, we enter what's called the supportive phase. Here, the focus kind of pivots from a full recovery to preserving the best quality of life possible. The goal is to maintain independence, manage symptoms, and help the patient take care of themselves for as long as they can. And finally, there's the palliative phase, when the focus of care shifts away from a cure. Rehabilitation still plays a vital role in making sure there's comfort and dignity. It's about managing pain, preventing other issues from popping up, and providing support that really honors the patient's wishes and just maximizes their quality of life. So who are the people actually providing this care? And what kinds of problems are they solving? Let's take a look at your team and the tools they use. First off, this is absolutely not a one-person job. A patient's care is guided by a whole team of specialists. It's usually led by a physiatrist. That's a doctor who specializes in rehab. And they coordinate with physical therapists, occupational therapists, speech pathologists, and more. The real magic is in how they work together, sharing what they know to build a plan that helps you meet your goal. And the range of issues this team tackles is huge. And they come from two main places. On one hand, you've got problems caused directly by the cancer itself, like pain if it spreads to the bones. And on the other hand, you have side effects from the treatments, things like lymphedema, which is that swelling that can happen after surgery, or nerve damage from chemo. So let's zero in on one of the single most common and just draining side effects: cancer-related fatigue. It hits up to 90% of patients, and this quote really captures it perfectly. It's described as an overwhelming and sustained exhaustion that is not relieved by rest.
This is a completely different animal from just being tired.
And, getting this difference is so key. Normal tiredness, you get some sleep, you feel better. Cancer fatigue, it just doesn't work that way. It's a persistent medical condition. And just telling someone to get more rest can be the worst advice you can give. In fact, one of the best treatments is actually a very specific, carefully designed exercise program. Crazy, right?
And the support goes way beyond just fatigue. The rehab team helps patients manage chronic pain, work through the anxiety and depression that are so common, and improve their mobility and balance to stay safe. It's all about finding new ways to handle daily life, and even training family caregivers, which can seriously reduce their stress and make them feel more confident. So, what does this all add up to? What does this mean for the future of how we treat cancer? Well, it points to a new and, frankly, a much more complete standard of care. So here's the main takeaway, the thing to remember. Rehabilitation is not an optional add-on. It's not a luxury. It is a fundamental, evidence-based part of good cancer care. It's what makes sure that we're not just treating a tumor, but that we're treating the whole person who has to live with all the consequences. And that really leaves us with one final question to think about. If we have the tools to improve not just how long a person lives, but how well they live, their ability to function, to work, to be part of their family, to live with dignity, shouldn't cancer rehabilitation be a non-negotiable part of every single patient's treatment plan, right from day one?